Hello, and welcome to Careers in Aging Week. We're with Katie Ries today. Thank you so much
Yeah,
for being with us. I'm so excited to learn more about what you do. So
thank you for
tell
the
us,
invite.
so happy you could make it. Tell us about your role on campus,
hmm
your occupation. What do you do?
Yes. My full-time gig is I am a social work specialist with the palliative care team here at the University of Iowa Hospital. There is a pediatric palliative care team and there's an adult palliative care team. I am on the adult one. So I do not do much involvement with the kiddos. Um, and then I currently also am an adjunct instructor over at the School of Social Work. So some people might recognize me from that. I have previously taught Aging Matters, the course over there, and now I teach Death and Dying on campus. So people probably
Perfect.
recognize me from that arena. Previous to this role here at the university, I've been here about 6 years in this position, and then previous to that, I did work for a hospice agency for about a year. And then I spent 8 years at an agency up in Cedar Rapids called Aging Matters, which worked exclusively with the older population in their homes in Lynn, Benton, and Jones counties.
So, a wealth of knowledge and
Yeah.
experience related to older persons, which is
hmm
fantastic. And
hmm
and we know that this role in palliative care isn't limited to working only with
Yeah.
older adults, but probably primarily your caseload
Yeah.
does focus on older persons.
I would say, yeah, a majority, over half at
Over
least,
half.
are
Okay.
older adults. We do see anybody 18 and older, but
hmm
a good percentage, high percentage of the patients I work with are older adults.
Okay. And you've been working with older persons for
hmm
years, as you highlighted. What
Yeah.
inspired you to be interested in aging and working with older adults?
I actually laugh whenever I get asked this question. But the answer is I needed a job, right? So
Yeah.
when I was a student, I got my BSW and my MSW degrees here at the School of Social Work in Iowa City. I wanted nothing to do with the elderly population or end of life.
It's
I wanted to work with kids, right?
right.
Um, so, however, after you graduate, you need a job. Those student loans are going to start kicking in. So I started essentially just applying and interviewing for whatever agency would ask me. And the first agency to offer me a job was the hospice agency. And so at first, I know I was pretty hesitant to take it just because that wasn't the area I was most interested in. But I will say I am so relieved and happy that I did accept that job and that I got offered that job, just because it sent me on the path that I'm on now. And I fell in love with it
Yeah.
right away.
Look at the path you're on now. You can't
I
get
know,
out.
I know they're stuck with me. And I remember telling people back at the School of Social Work, like after I was working in this field, like, I should have listened to you guys. You were trying to steer me in this direction, and I wasn't having it. But I'm so relieved about it. I found and I still find that it is incredibly easy for me to communicate and connect with older adults. I have found myself to be incredibly protective and passionate about this particular population. I love talking with them. I love learning about their lives, their
hmm
experiences that they've
hmm
had. It's truly rewarding. It really is.
Excellent. They're lucky to be working with you.
Thank you.
Tell me what a day in the life of Katie Reese, a social work specialist with adult palliative care looks like.
Yeah. Each day is a little bit different. Some days are a little bit more challenging than others, but I guess typically I have an IDT team. So I have an interdisciplinary team that I work with every day,
hmm
made of physicians, nurse practitioners, nurses, chaplains, pharmacy.
Mhm.
And so we touch base every day. We have a list of patients that we have hospital wide, and we touch base and figure out what each patient has going on and what social work needs they might have.
Mhm.
As I had mentioned before, a lot of the patients we work with are 65 and older. Um, and the patients we work with here at the University Hospital are those who have a serious, a life-threatening, or a terminal illness or condition. So we have a
Mhm.
lot of really sick patients.
Mhm.
So a lot of my days I'm spending time talking with patients and their families about what kind of medical care they do want, or maybe that medical care they do not want.
Mhm.
Maybe where do they draw the line?
Okay. And
I
hospice and palliative care, they're different.
They are different.
Mhm.
They're
Mhm.
they're two different types of care. There's
Yeah.
some similarities, there's
Mhm.
some
Mhm.
overlap. Yeah,
Mhm.
palliative care can be for people who have a serious or life-threatening illness, but are still pursuing aggressive or life-prolonging treatment.
Okay. Okay.
Um, Whereas hospice, again, a lot of similarities to palliative care, but
Mhm.
hospice is specifically for people who have a terminal condition with a life expectancy of 6 months or less.
Mhm. Mhm.
So a lot of the patients we have here at the University Hospital will get involved on a palliative care, um, I guess, aspect, but with more conversation and with more
Mhm.
discussions. And as
Mhm.
time goes on with their hospitalization, a lot of times they do end up going a more hospice end of life route.
Right. So you do a lot of counseling and clarifying goals and establishing goals and
Absolutely. We talk with patients and their
Mhm.
families about, this is what's going on with you medically.
Right.
These are your treatment options. Here are what you can expect with each treatment option.
Mhm.
Tell us what aligns best with what's important to you,
Mhm.
your
Mhm.
values, what gives your life meaning and quality. And so we try to help them make decisions based on all of that
Yeah.
information. We want them to make informed decisions.
Right.
So we do a lot of goals of care discussions, a lot of family meetings. I'm doing a lot of assessments with patients to
So
help.
important.
Yes,
Mhm.
to help determine what are their needs, what
Mhm. Mhm.
resources and supports and services might be helpful to
Mhm.
them, whether or not they're going a hospice approach or a curative approach. They
Mhm.
still might need resources and
Mhm.
services,
Mhm.
right?
Absolutely.
I will say most of what I do though is in the more of the hospice and end of life route.
Mhm.
So I help a lot of patients transition to hospice care. I help make arrangements for patients to go home for hospice care or maybe to a
Mhm.
local facility for end of life care.
Mhm.
Helping a lot with advanced directives. So which includes a lot of medical power of attorney documents and I post, which are
Right.
here in Iowa, a lot of grief support, a lot of bereavement support, legacy building for individuals who may be nearing the end of their life.
Mhm. Mhm.
And then, of course, unfortunately, there are times where I'm also involved in doing crisis intervention, identifying and maybe locating legal next of kin or surrogate decision
Right.
makers. We have a
Right.
lot of patients who end up here that they're not able to speak for themselves. So a lot of what I do sometimes is just trying to figure out who exactly are we supposed to be talking with and how do we get a hold of them.
Mhm. Mhm.
And then, of course, making some occasional reports to DHS as well for suspected like abuse or
Okay.
neglect.
Okay.
Yeah,
You're right. No 2 days seem like they're going to be
it's
like, especially
really
when you're working with
varies.
people.
Yes,
Um,
yes,
Excellent. So, why do you think it's important for social work students?
yeah.
You're a social worker.
Mhm.
Why do you think it's important for social work students to study aging?
Yeah. So in my aging matters class that I used to teach in the death and dying class, I could go on for hours about this particular question. What I can say is really no matter what field you go in or what
Mhm.
career you
Mhm.
go down or what you do down the road, you're going to be working with the elderly and the older population in some capacity, whether it's cosmetology, you're going to be having older people need their haircut and things
Mhm.
done
Mhm.
in that arena. And whether maybe it's retail, no matter what you're
Hmm.
doing,
Hmm.
there's going to be
Hmm.
some work with the older population. What I would say is there are going to be some careers that do work a little bit more with the older population or maybe exclusively with the older population. And what we're seeing right now is that we're having this major shift in our population demographics, not only here in the United States, but worldwide.
Hmm.
We have the baby boomers who are aging. We're seeing more and more people over the age of 65. I think
Hmm.
we might now be at a point where those 65 and older outnumbers the number of children under the age of 5.
Right. And
Um,
particularly in Iowa, it is nation
yes.
and worldwide,
Yeah,
but particularly in Iowa. So great. Yeah,
absolutely.
great point. Hmm.
This is a huge shift, and it's something that is going to greatly impact our healthcare and social service delivery
Hmm.
systems. It's going to
Hmm.
impact our workforce. We're going to see more and more people who are retiring, and we're going to need people in those shoes, in those jobs, to help take care of this aging population.
Hmm. Hmm.
It's going to change, it's going to shift our resource availability. Those in my class have heard me talk about how the hospital, and not only our hospital, but other hospitals, are always full right now. We have
Hmm.
limited bed
Hmm.
availability.
Hmm.
Home health agencies, hospice agencies, nursing homes, these places are all so full, or they just don't have the staffing to keep up with the demand.
Hmm. Right,
Um,
right. And we need to know what their needs are and how to work with this population
yes,
in
absolutely.
whatever realm, as you mentioned, but
Yeah.
especially in this healthcare social service,
Yep.
the need is just there.
It's so there, and
Yeah,
the needs is only gonna get greater,
it's going to get
really.
greater. Yeah.
And
Um,
then if you talk about like our federal and state entitlement programs, Medicare, Medicaid, Social Security, how
right.
this population shift is gonna change that too. So a lot of different
Major
aspects.
implications.
Absolutely. Yeah.
What do you love most about working with older
Oh,
persons?
I would say their life experiences, which I know I talked about a little bit earlier. Their perspectives, they come from different generations and a different time. And we now live in this time where social media and technology just kind of runs the world, but a lot of these older persons were living in a time where those things did not exist, and so they're
Hmm.
from, maybe some might call it a more simpler time. So their perspectives are so interesting to me, um, and their wisdom. If you look at the people and what they've been through, and what they have witnessed throughout their lifetime, they are incredibly wise people.
Hmm.
And I always, when I see somebody who's maybe 90 or older, I kind of just I want to take those patients and make them mine. Like, I want to take
They're
this
the
patient.
best.
They are the
Yeah. Give me
best.
85 plus.
Yes, they're the best. And I always say I love some of their feistiness. And a lot of times we wonder, how did some of these people get to be 90 plus or 100? And
Right. I want
I
your secrets.
yes, it's sometimes their feistiness. Some might argue their stubbornness, or maybe just their overall positive outlook on life. Got them to that point. Whatever it is, I love everything about it, and they're just my favorite population for sure.
I love your passion. I love your passion. I'm so happy that we got to talk.
Yes, me too.
Thank you
I'm
so
so happy
much,
to share
Katie.
all of this, and look forward to talking with anybody if they have any other questions or anything like that.
Excellent.